All right, so I'd like to call to order this April 24th, 2025 meeting of the Healthcare Advisory Committee here in City Hall at Council Chambers and also online via WebEx. Kim, do you mind doing roll call real quick?
Put my glasses upstairs, but sure. Chair Simpson,
Here.
Member Robinson,
Here.
City Council Member Zingy,
Here.
Peace Health Community Member Kate Cavares.
I'm here, but I'm not technically part of this meeting.
Okay,
I'm just a member of the public.
Okay, and then Scott Smith.
Here.
Tim Horton.
Here.
And Sarah Cook.
Here.
So you got a full quorum.
Excellent. All right. So moving on to communications. The only thing we have is some information that was provided by our mobile integrated health team who has signed up for persons to be heard. Don't believe we have any other items for communications. So with that, I think we'll go on to persons to be heard. So Gretchen and Ben, if you don't mind, love to hear an update.
Thanks for
Program.
give you guys an update.
You need to make sure the mic's on. It's in the back here.
Test. Testing 1, 2, 3.
I can hear online.
Testing 1, 2, 3. Okay.
Yep, we can hear online. Thank you.
So my name's Ben Watson. I'm a community paramedic with the Fire Department's Mobile Health Program. And this is Gretchen Sullivan, my boss. She's my partner for the last several months. And just a brief synopsis of what we've been up to. So the program launched June 10th of last year. To date, we have just over 500 patient contacts. So we're averaging maybe 2 or 3 patients a day. Volume has definitely gone up since we launched our clinic with the Salvation Army and Public Health. Essentially what that is, every Thursday we go and we provide free wound care, checkups, education to a population of patients who maybe struggle just to get connected with proper healthcare resources. We've had really good luck with that. We have over 90 people, majority on campus, signed up and participate in that clinic. And we provide things like food, basic needs, socks, underwear, feminine products. We partner with Public Health as well. They send a nurse with us every other week. We do vaccinations, rapid STI testing, you name it. So that's been a very successful program so far. We also send a good bit of referrals to the substance use programs that are now thankfully here and running in town, Search and True North. We've had good luck so far partnering and working with them. We look forward to continue to building those relationships. Our most beneficial relationship so far is definitely Peace Health. We work really closely with their social work team, as well as home health. We have a number of patients who are waiting to be seen by home health, so we'll kind of bridge that gap until they're able to get connected to wound care. We can do medication reconciliation, things like that, make sure people are taking their medications, you name it. We work pretty close with some providers at Peace Health doing things like lab draws, EKGs, any type of testing they need. If the patients are homebound and can't get to the hospital, we'll go to their house and do that for them. We do telehealth. We've had some really good luck working with our what we call high utilizer populations, individuals who, by our definition, call 911 on average at least once a month, so 12 or more times a year. We were able to identify at least 25 individuals in the community who meet that criteria. Out of that 25, we were able to reduce their call volume by about 80%. So just getting them the help that they need, a little bit more attentive, and we have a lot of time to sit with these people. We can spend an hour or two with them, really figure out what's going on, social determinants of care that are affecting the health conditions these people have. Out of that 25, 17 are no longer in the program at all. They've been discharged from the program, reduced to 0%, and that's because of either relocation. And when I say relocation, I don't mean just buying a plane ticket and sending them somewhere else. When I say relocation, they're either admitted to inpatient treatment for substance use, they're admitted to assisted living, or they're reconnected to family. Playing hot potato with people we're solving their issues, hopefully. We have a few patients in that demographic we're still actively working with, and luckily just this last couple of weeks we've had some good headway with some of those individuals, and hopefully we'll be able to get them the help they need in the coming months, and hopefully we'll be able to reach that 0% call volume from those 25 individuals. I'm pretty optimistic so far. So If you guys have any questions about the program, we're happy to answer them for you.
Any questions from the room or online?
Just a comment. This is Dr. Horton. We've heard some really good things, so we appreciate what you're doing.
Thank you.
Anybody else online? Thank you guys very much and agreed that this has been an incredibly successful program. So keep up the wonderful work and hopefully we'll have another update from you in the future. We would appreciate that.
Thank
Well,
you.
Alright.
Appreciate it.
Well, of course, I guess I got one now that I'm thinking about it. You said you had several people waiting for home health. Is that just a backlog or is there?
Yes, correct.
So there's not
A couple weeks out until they can get to them.
Okay, so there's not holdups with just the relationship in general?
No.
Awesome.
Yeah.
Thank
Thank
guys.
you. Okay, Bob Severson.
Thank you. I'm here speaking for myself. I had the unfortunate opportunity to have to use the emergency room not too long ago, and I just want to say that the experience, though medically was concerning, the staff and the hospital did a fantastic job of managing my emergency services at the facility. I had some imaging done. Of course, they did all the blood workups and stuff like that. And the emergency room staff were courteous, friendly. They kept checking back to see if there was anything that I needed. They were comforting my wife. And so I just want to make sure that people understand sometimes you have bad experiences, sometimes you have good experiences. But from my experience with the hospital, we're very fortunate to have the ER and ER staff and hospital staff that we did. I think they perform a fantastic service for the community. Thank you.
Wonderful. Thank you, Bob. Okay. Is there anyone online that would like to address the committee? Hearing and seeing none, we'll move on to item number 5, which is approval of the January 23rd, 2025 meeting minutes. Is there a motion to approve? Will be formal.
I make a motion to approve the meeting minutes of the meeting of January 23rd, 2025.
Is there a second?
I'll second.
And then Scott, thank you. So the draft minutes, thank you very much, Lori, as always, for putting those together. Oh, she's saying that she can share, but she needs permission from you, Kim, I think, to share screen. We're just having lots of good technical fun today.
She's sharing the agenda. I'm pretty sure I'll stop sharing and she should be able to.
But we did provide the draft minutes to the group and posted with the agenda. If there's any changes or questions, now is a good time to raise those. Otherwise, we'll move to approve. Agenda. Okay, if there are no comments or changes, all in favor of approving the January 23rd, 2025 minutes, please say aye. Aye. Any opposed? Hearing none, those are approved. We'll move on to agenda item 6, old business. We have 2 updates from Peace Health. Hopefully Lori can share screen. First is on the operations and activities of the same-day clinic, and then update on the emergency department renovation. These have been standing agenda items for the HAC for quite some time, as they're both ongoing and large and important projects. So,
Lacey, hi, this is Lori with Peace Health.
Hey.
I cannot share my screen. It shows that I'm sharing and then you guys completely black out. I don't know what's wrong with my connection, but it's not working. I did send the presentation to Kim via
Okay.
email. If she can open that up, she can share it for you guys.
I can't get email on this computer.
Okay. I am stumped as to how to get that information on the board.
yeah, we can see, is that on the
No,
screen,
it's-
Kim, is that hers or yours?
No, I think it's the meeting, so
That's not mine. Let me try again.
I've got share in call and it keeps fading away, like when the podium was, it go away
Right.
and so it's now your agenda's up. Is that what you're trying to put up, Lori?
That is what I'm trying, but I can't, when I show my screen, you guys are gone, so I can't see what you see. Do you see it?
We see your agenda.
Okay, I'm gonna go ahead and mute myself and I'm just gonna listen to you as to where to go next.
Lori, you want to share the slides?
Yes.
Thank you. All right. So the same day care is transitioning to a new name, Priority Care. So that's the only thing that's changing, and that's just in line with the rest of the same day care clinics throughout Peace Health. So, and then online scheduling is available to paneled patients, which is really exciting, and it's really easy to use if you've tried to, if anybody's experienced using that yet. Next slide, Lori.
Can I tag on to that slide just real quick,
Mhm.
Sarah? Along with the online scheduling, this is same topic but unrelated. We also have made available online scheduling for screening mammography through MyChart. So that's been another kind of nice addition. We haven't had a ton of utilization yet, but we haven't really put it out there advertised. Just folks who are seeing their reminders in their chart have the ability now to just click on a link and schedule. If there's limited openings because the scheduling is a little complicated at times, depending on which radiologist is in town, but they can always still call as well, but that option is available too, and it seems to be popular, especially given that we haven't really advertised that opportunity yet. So. Thank you.
Yeah. So the ED renovation, we are still in phase 1, which is the CT. Construction is ongoing and we're right on schedule, and completion should be done this summer. I'm really excited. It's looking really beautiful. So
Yeah.
do you have like an update on which month?
Yeah, I mean, as always with these, we're hesitant until we get a little closer to provide exact dates, but we have no reason to think that it's going to get delayed at all. So we should, we're on track right now for mid-June to have a functional CT scanner and owner occupancy. So that's still our hope. There's some training, new scanner and things like that that have to occur. So, you know, the first patients will probably be closer to the end of June as long as we stay on schedule. But yeah, it's going to be a really nice updated new space. Our current space, as we've talked about before, really isn't, even though a large percentage of what we do is outpatient focused. Our current space is really more of an ED inpatient kind of space. There's not really consulting space in there. You kind of walk right into the control room, and there's really not a place to talk about, you know, any potential complications or get histories, that kind of thing in the new space. It's not over the top, but it's just there's consulting space and a formal changing room, restroom, and those kinds of things. So it's going to be really nice for our outpatients. Much better design in that sense.
Lori, can you go to the second slide, please? So we are getting prepared for phase 2, which is the lab relocation. This needs to happen to be able to expand the ED. So capital funding has been approved and contract has been awarded for the architecture and engineering. And then we are in the middle of discussion with the state on the certificate of need. All right, do you want
Can I
me?
say one more thing
Yeah.
about that? I think the one thing that might be important for and you guys may be in this loop, Amanda, maybe you've had some conversations with Eric, but the number of rooms, I think with, you know, when we start talking about the expansion of the ED, the state in a lot of ways dictates the number of rooms that we can have.
Interesting.
So I just want to make sure we're kind of setting the right expectation to the city and the public in regards to what that will really look like. I think there's maybe some potential that an ED renovation is the better terminology than ED expansion. I don't want to give people the impression that we're doubling the number of ER rooms or that kind of thing. The flow is going to be better. We're still hoping that the new design has an impact on wait times and all those things that we're trying to solve. But they do based on our volumes. It's annualized for our summer months as well, but based on our volumes, through the certificate of need process, I'll try to speak up. Sorry.
Otherwise you can talk into that.
Okay. Through the certificate of need process, they can kind of control the number of rooms that weren't allowed to have in there. So just kind of a side note, Eric Blake is working with the state to try to maximize that and kind of future proof that the best he can, but we do have some limitations with what the state will allow us to do through that process. So
Question on that. Thank you. That's really fascinating and helpful. Do you know if it's based on population or based on use? Because our use spikes so much in the summer. If that's something that's taken into consideration when they set that
I
need
think
threshold.
it is.
Good.
As far as that's my understanding anyway.
Yeah, that is mine as well,
So it's
yeah.
based on the volumes that you put through
Okay.
ED, and it is annualized. So that it should be taken into account. Yeah.
Great. And maybe at the next meeting, we can have more information on how that might play into the overall plans for.
Yeah, I would think so. I feel like Eric Blake has a pretty good sense for where it's headed.
Okay.
Which leads me to believe that they're close.
Yeah.
To maybe having a number. And obviously the contract that Sarah just talked about for the design work, we're going to have to know what that answer is really to get some meaningful design plans. So I would think we would, yes.
Great.
So ED staffing update, we have identified a new staffing partner, which is Apollo MD. Transitions are underway. We are having weekly meetings right now to ensure a smooth transition. And then a complete handoff will be on like August 1st. And we're able to continue to consistently have coverage 24/7 with our docs that are here. So, yep.
Sorry if I can ask a question about that. And I think I have the answer, but just for disclosure, you went through an RFP process as
Correct.
part of trying
Yes.
to locate the new contractor.
We did.
Excellent.
Yep.
Okay. And then is Apollo used in other Peace Health
No.
facilities? Okay.
Mm-hmm. Nope, they're new to us
Okay.
as well. So some community collaborations. We had the legislative fly-in in February. We met with Representative Begich and his staff for a couple weekends ago, which was wonderful. And then we're continuing to collaborate with Rise True North and KIC. And then the landslide EOC. So yeah, been busy. Next slide, Lori. So the Prince of Wales Peace Health Medical Group Clinic just celebrated their 15-year anniversary, which has been really awesome. They did it in a collaboration with the City of Craig, Public Health, and Community Connections. So it was a really fun event, and just to see how well the three of them are all able to work together to provide care for the community. It was just beautiful. So next slide. Other updates. So the front desk is under a remodel right now. Walking in, it was very kind of closed off and dark. So we've taken down all of the plastic glass and we've recessed the desk back. So it's a much more open space. And then you can see in the middle, it allows for somebody in a wheelchair to be able to roll right up and sign in. Matches are the way the clinics are. So more to come in the back, but it's just, we'll have two people sitting up front. It's just, hopefully will be more bright, more welcoming, much easier process for checking in. Gift shop is opening up soon. We're still in the volunteer recruitment process. And then up in May, we have lots of recognitions happening. So Nurses Week and Healthcare Workers Week are both in May. So we're going to be doing lots of fun stuff for all the caregivers. So next slide, Lori. Lori, oh, are you able to hear me? Next slide, please.
There is no
That's
more
it?
next. That's it.
All right,
Yep, we're done.
perfect. That's it.
Thank you.
All right. Well,
Great, thank you very much, Sarah and Scott. Are there any questions from folks in the room, folks online? None, yeah, just to, again, really appreciate the updates, especially on the ED, because that's a very big project and obviously a multi-year project. So it's nice to see that it's still
Moving
advancing
forward,
and
yeah.
flipping forward. Yeah, that's great. Okay, if there's no other further comments on old business, we will go to new business. At the last meeting, it was requested that the city give an update on the Tongass Avenue construction project and any impacts to the hospital. So I've asked Amanda, who is knee deep in this, to provide an update. And I think some of it is already, PSAL's already been informed of it and underway, but if you don't mind.
So right now, as you know, the KIC entrance is being worked on. There will, when the paving crews return, there will be another shutdown of their entrance to do the paving portion of that. They've done the concrete. Next, they'll do the little paving section. So they will again have that little bypass through the parking lot. But it'll be a smaller shutdown time because paving doesn't take as long to, they don't have to have the cure time. So that would probably only be a day or two. So anticipate that. I'm not quite sure when that's going to happen. I'm waiting for the superintendent from CCON to let me know, but I will definitely let you guys know as soon as I know. Also, we do not know when they are going to start paving in that area, but we're looking at this summer that they will do some paving in front of the hospital. We will let you know as soon as we know what their plan is. We're hoping that they will do the lane shifts, and so there won't be any one-way traffic happening. There definitely will not be any shutoffs to your entrance. We'll make sure that you have access at all times. There will be flaggers there to allow for entry and exit at all times, but hopefully they will do the lane shifts instead of one-way traffic. So if we hear any different, we will definitely try to give you as much advance notice as possible. So we just don't know yet what their schedule is. We try to keep in constant communication with them, but we haven't heard anything about when they're going to start paving there. They're still on the sidewalks on the opposite side of their project. So, right. Yeah, wait and see.
Do you have any further questions about just general construction? I think you know this, but just sort of relatedly, and hopefully I don't have this wrong, but as a result of the Wolf Point landslide, that helipad that is just north of the slide area is not in use any longer.
Yes.
And so any medevac helicopter activity is taking place at the airport. And so we're shuttling people via ambulance. So that's more of a concern for our EMT services. But again, we're in constant communication with the hospital and we're bringing patients to and from the hospital. So just that, so that you're aware that that process will take a bit longer. Then of course, whatever may be going on with construction may impact times and getting people to the hospital. And there are a lot of projects in the community.
A lot of projects,
Yes. And that's not going to change for
Yeah,
the next several years. So
the Tongass paving is just one. There's also paving that is starting from Wolf Point heading north through the Don King Walmart light even just a little farther than that. It'll also be hopefully just lane shifts, but it's going to slow down traffic and probably slow down EMT response times and things like that. So, and that'll be happening all summer as well. So just FYI, it's going to be busy and congested. So.
Were there any questions online? Tim, I think maybe you had brought up this topic at the last meeting, so I just want to make sure that you had an opportunity to ask any questions about hospital impacts before we move on.
Yeah, absolutely. Any update on the parking lot across the street from us?
Yes, that is scheduled to be paved when the first paving crew arrives in the first week of May. That is #1 priority. So I will get you guys an email as soon as I know when they're gonna start. But that's #1 priority for the paving crew.
Great. Thank you.
Yep.
Okay, any other questions on DOT projects and impacts to the hospital? Seeing and hearing none, we'll move on to the next item, which was a discussion about lighting along Tongass Avenue and concerns about pedestrian safety, I think chiefly around the hospital, so that pedestrians that are entering and exiting the hospital had adequate lighting. I'm a little fuzzy on this, so I'm going to turn it over to Peace Health because I think this was mentioned at the last meeting as a
Yeah, it's
concern
the
from your
lights
side.
at the stoplights.
At the stoplights, okay.
Yeah, because those are DOT. They're not
Carolina.
currently working, so that, yeah, so when, at night when people are crossing, there is no lights there.
Oh, okay. Okay.
I think the crosswalk that's right across from the clinic building is back on now. Like when you push the button, it'll light up, but it was off for a while. So, and anytime they seem to do any construction, they shut it off. So just a reminder to turn it back on. A lot of people use that crosswalk to get across from that parking lot and from walking along there.
Yeah, I know the lighting for that is back on. And so the lighting at the Carlana intersection is not on.
Okay. That's what we were talking about last time. I haven't verified that it's not back on, but that's what was brought up.
Okay. I will talk to DOT about that and make sure that all the lighting is back on, because that is definitely a pedestrian safety issue.
Yeah, obviously it becomes a little less of an issue this time of year, but it's
Definitely under with
when folks are.
I think they are back on. At least they were 2 days ago. 2 days ago I crossed, or late last week. But they were off for a while, for sure.
Yeah. I will bring that up in our next meeting.
And generally, because I don't really notice when I drive by, you are more in tune with this. Do you think the lighting is adequate when it is working?
Yeah, the crosswalk is really good and bright and flashes, and most people are pretty good about stopping. I use the crosswalk to go walking at noon. I've certainly gone the light, and I think it's fine too as well. I think the lines are all messed up, so the painted lines, getting those lines back on would be really helpful, just so people kind of notice that it's a crosswalk.
Yeah, we've talked to the DOT maintenance crew that they do the painting during the summertime, and they've been trying to focus on the downtown area right now, getting ready for the tourist season, and then they're going to kind of spread that way. So hopefully they'll get there soon.
I don't know, Amanda, just in your conversation, I don't know if there's opportunity for other lighting in that corridor, like if there are utility poles that don't have lights that could have lights, if that's a conversation.
We can bring it up to
Yeah.
them. Yeah, I think most of the utility poles in that section do have a light on them. Seth and I actually were staring out the window the other day because we were talking about this, and he's like, "It looks like they most of them do have a light on in that section." So, but we can definitely bring it up because we talk about these safety issues with them constantly. Right. Yeah. So, okay, it's what gets picked up.
Yes.
Yeah.
Yeah, that was the specific call out that was brought up by our caregivers was
Mhm.
the actual street lights, not not
Yeah.
the, that are on both those crosswalks there, Carolina and Tongass, those were out, yeah.
Yeah.
Okay.
Okay.
Okay. Well, we can check on
On
those.
top
Thank
of the
you,
utility.
Amanda, for
Yeah.
continuing the conversation with DOT. Any further comments about lighting around the hospital? Hearing and seeing none, we'll move on to new business item C, which is an update on capital improvement planning. So at the last meeting, we discussed a bit about trying to get our capital improvement program back on track with the hospital. When we did our lease negotiations through our third-party consultant, we identified a number of projects that remained outstanding for the hospital, some of which have been accomplished, and the list needed to be reprioritized. Scott and Amanda had sort of looked at that list. I think we still need to reevaluate it for some prioritization. So that's an ongoing project, but I did want Amanda and perhaps Scott just to chat a little bit about projects that are now underway that have a bit more urgency at the hospital that I'm not sure if they were on that list or not, or sort of cropped up, but in any case, just wanting to demonstrate that the city and Peace Health are still collaborating and trying to get those capital improvements back on track. So Amanda, if you don't mind giving an update, I'd appreciate it.
So the KMOB roof warranty issue is finally getting some traction. The roofing contractor will be in town on May 3rd to come take a look at the issue and try to make some preliminary repairs. Not quite sure if they will be able to do anything. I'm not sure if they really understand the problem yet, but they'll see when they get here. So I have my schedule available for them, and Pat McLavy is aware that they will be here. They should be here for the rest of the week through that time to take a look, and then they should be creating a plan to come back this summer and fix a warranty issue. I think that it's going to be a larger issue than they think that it's going to be. So we'll see when they get here and we'll talk to them. But at least we're getting traction and they're actually going to show up, which is good. Yeah.
Thank you for staying on that.
Yeah, it's taken a lot of hounding.
Doing what you could to get
Yeah.
their attention.
So that's good. And the physical therapy wall water intrusion, we authorized Marble to start the demolition. Pat is going to coordinate with Marble to get them in there and start the work and see what we can see, if we can see anything. I still have Amanda Welsh working up a proposal for design. It might change a little bit depending on what we find in there. And then we can move forward with a plan to hopefully fix what's going on. And since we're going to go into budget season a little early this year, we should look at that list and see if we can identify some projects that we can get started in 2026.
Yes.
So,
great.
Yeah.
Okay. So I think we'll have to have another offline meeting
Yes,
to drill down on that
Probably
list and reprioritize
in May.
in May.
Yeah.
Okay.
So what I think we can commit to on our side is I'll get together with Pat, review that list, that spreadsheet that I brought.
Okay.
Was that the last meeting before?
It was
maybe?
last meeting.
Was it? And Pat and I can just kind of from a Peace Health perspective, do a first round of prioritization off that
Sure.
list and then maybe reach out to you and get a meeting set up to review that and
Yeah, that sounds good.
look at costs and try to get a joint
Yeah.
prioritization.
Yeah, that
After
sounds
that.
great.
Great.
When would you like, you said by May for his?
Sometime in May, because I think we're going to start budgets process in June.
Okay, so a goal to kind of have that meeting and have that list finalized by the end of May or by
Yeah.
mid-May?
That would be helpful.
Thank you.
Thanks to both of you for continuing to work on that. Are there any questions online regarding capital projects at the hospital? Perhaps at the next meeting, we'll have more to talk about once that list has been prioritized and we set some goals for the next year. Okay. Okay, moving on to new business item D, which I believe we really already covered, which was just to highlight the changes with the staffing contract for the ED, which is now Apollo. So I'm not sure if there's any further questions from the room or online about that provider, or anything further you wanted to say, Sarah, about it.
I mean, I'm happy to answer questions. I don't.
Nothing changes with that relationship in terms of the billing for the
No,
public, so
It's
those,
all the same.
okay,
Yeah.
so they would still receive
Yep.
2 separate bills, yeah.
Yep.
And I apologize, I was out of town. Was there any sort of public announcement about that? Or is the public, for what it's worth, just so that they know, since it was unfortunately very well publicized when the last provider dropped out, to let folks know that a new provider's been lined up and there won't be any
I don't
disruption.
think besides reaching out to you all and Kate, did we publicize anything? I don't remember.
We didn't. It was pretty operational
Yeah.
and didn't change any of the patient's experiences. And so we opted to just keep going as business as usual.
Okay. Any questions or comments from folks online about that topic? Hearing and seeing none, that concludes new business. So we are on to future agenda items. Does anyone from the group have any suggestions?
Excuse me, Madam Chair.
Yes, Ms. Zangi.
So I hope you can all hear me okay. I right now have a list of about 20 or so questions about various parts of the hospital. The ER staffing contract is one of them, but well, it doesn't really pertain to the contract. Primary care, I think there is nowhere really on the agenda for me to address those today. So my hope would be to put together a list of questions and send them out and see where they fit.
Absolutely, Judy. Happy to have further conversation with you about that.
Yeah, sure.
Or we can stick them on the next agenda. We'll talk more about it. How about that?
That sounds good. We could talk more when I could actually talk.
Are there any other future agenda item suggestions?
Have any?
So I think for next time we'll do same day clinic and ED renovation, just because those have been standing. Have a conversation with Judy on any suggestions that she might have. Perhaps the capital improvement. One thing that's sort of lingering out there, I'm not sure if it rises to this level quite yet, but Sarah, you and I should probably have a chat at some point about the 5-year review process per the lease, just so that doesn't completely sneak up on us.
That doesn't seem possible.
I know, it doesn't seem possible. We're not quite there yet, but like I said, I didn't want it to
I know.
sneak up on us. Yeah. Okay. Any comments or other statements from the group?
I don't think I have any.
Kim?
I see on the agenda, it says the next meeting is Thursday.
Yes, I did not update that.
August, the last meeting in Thursday in August.
July.
July. It's quarterly, right?
Mm-hmm.
Okay,
Yeah.
July.
July 24th. That's my mess up. So apologize to everybody. The next meeting will be July 24th, not today. Okay. If there are no further comments or statements, I think we'll move to adjourn the meeting. Thank you, everybody that was able to join online. Judy, I hope you feel better. And Tim, thanks for joining us from POW. Appreciate it.
Of course. Thanks for having me.
Thank you.
Thank you. All right. Let's see you.
Bye.